Okay, a warm welcome everyone to this ReAct webinar on mobilizing collective action ahead of the UN high-level meeting on AMR in 2024. My name is Kerstin Åkerfeldt and I'm a policy advisor at ReAct. And thank you all for joining us today. As you know, AMR is a global challenge. We hope that you all believe, as we do, that to address antibiotic and antimicrobial resistance, we need to mobilize globally for more collective action. So we're now less than 1 year away from an important opportunity to demand leadership and action on AMR from the highest political level around this meeting. So the Global ReAct Network is currently discussing how we best can contribute to this mobilization, and we hope that this can be the first in several interactions in the coming year with many of you on this call. So for today's webinar, we would like to share some insights from a meeting that ReAct organized earlier this year, where AMR experts discussed some of the key issues of concern to be addressed by world leaders at the highest level meeting in the UN General Assembly. And we have also invited 3 prominent speakers to share their reflections on some key challenges and opportunities on the road to the UN high-level meeting next year and how we can navigate the current complex policy landscape. We will finish with an interaction that includes opportunities for questions and exchange with you online. And I want to already now encourage you to log in to the Mentimeter using the QR code that you see on the screen or the link that will be in the chat to share your thoughts on what you think are some of the key actions that are needed ahead of the high-level meeting to make it a real success. So your Mentimeter contributions will form part of the public record of this meeting. And I want to mention also that this webinar will be recorded and made available on ReAct's website. So now I'm pleased to introduce you first to my colleague, Mengying Ren. She's a policy advisor here at ReAct, and she will provide a summary of the dialogue meeting in May. Mengying, over to you.
Thanks, Kerstin. And I hope you can see the slides. So before turning our attention to the Uppsala dialogue meeting, allow me to briefly touch upon the high-level meeting process. And here is a picture from the last high-level meeting on AMR back in 2016. And for those who may not be familiar with UN governance, especially as we anticipate the upcoming high-level meeting in September next year, it is important to note that the UN General Assembly carries considerable political weight, and the strength of a dedicated high-level meeting lies in its true high-level nature, where consensus and commitments are made at the head of state level. And this provides a unique opportunity for the global community to renew political momentum, mobilize funding, and reach agreement on cooperation measures and solutions on AMR. And for the upcoming high-level meeting, Barbados and Malta have been appointed as co-facilitators by the President of the General Assembly. It will be a member states-driven process. And moving forward, we're waiting for the co-facilitators to present options and modalities, as well as potential deliverables. We hope it will be inclusive and transparent, with rounds of open and meaningful public consultations throughout the process. And ahead of the official high-level meeting, the Uppsala dialogue meeting came into the place and set a very early step to discuss and propose key components and steps for consideration on the road leading up to a successful high-level meeting. We had over 50 participants from more than 20 countries in Uppsala, and we're very glad that many of you are joining us today. The meeting was a collaboration between ReAct and Uppsala University with financial support from the Bayer Foundation and the Swedish Research Council. We recently published the meeting report, which summarized the key areas from the discussion back in May, and hope it will lead for continued deliberation towards a high-level meeting and a wider consideration in mobilizing collective action. AMR is a complex issue, and the meeting participants agree that it is crucial to find ways to describe a common vision and aspirational targets to drive action and change behavior. We believe that a common vision will drive the narrative and target setting. We need to be clear about what we want to achieve and what is needed to achieve it. And diving a little bit deeper into the framing of the issue, a stronger and clear narrative is a key enabling factor. Such a narrative on ABR should formulate the problem and its consequences in a manner that is relatable and inspire action. It should show a clear connection between action and effect. And we need to bring a uniting, holistic umbrella narrative with a more people-centered view to connect different stakeholders' perspectives. It should try to move away from technical language and include more relatable issues that can engage people. And specific narratives, that is the content of the messaging, they're needed for different audiences, and how we can frame it so it brings hope and a conviction that we can do something about the problem. We also believe that it will be productive to co-create the narrative and solutions from the bottom up, and engaging wider communities to discuss and learn together about the issue and what can be done. And lastly, we call for concrete steps taken to improve the narrative involving social scientists, behavioral change experts, and other organizations beyond the usual suspects. And zooming in to the high-level meeting, we hope that the world leaders will step up and make bold commitments in 2024 declaration to deliver tangible results. And the Uppsala meeting had summarized the key areas, including robust access and sustainable financing for both global and national actions, and strengthened and coordinated global and national governance mechanisms for higher political buy-in and sustainability. We need to invest more in civil society mobilization and meaningful engagement from local people-centric communities to the global level, and ensure fair representation in the governance structures and decision-making processes. And last but not least, the accountability mechanisms and monitoring frameworks are critical for following through the commitments and the responsibilities of the global governing bodies, countries, and other relevant actors. And on concrete steps and processes for preparations towards the high-level meeting, we have come up with a few examples of what needs to happen, such as convene financing meetings, engage finance ministers and institutions, and set targets for robust and sustainable financing, and to collect and communicate about key evidence and data, including burden on health, economic costs, investment returns. Those are very critical for stronger political attention. And we also called for forming core groups of stakeholder representatives that will meet regularly and develop a common vision, narrative, and roadmap ahead of the high-level meeting, and really gathering and convening broader civil society and enhance collaboration across other health topics for joint advocacy on AMR agenda. So here's a very quick overview of what was in the highlights for the Uppsala dialogue meeting. And we'd really like to thank all of you who joined back in May in Uppsala for your valuable contributions. And for a more detailed look at the highlights, you can find the report on the ReAct website, and we'll also post that in the chat. Thank you very much.
Thank you very much, Ming, for sharing these highlights from the meeting. There were indeed very rich discussions with many more concrete proposals on the issues that should be addressed and steps to be taken. So we do refer you to the full report for more details, and my colleagues will put also here in the chat the link to the report. And we encourage you also here to share some questions or comments that you might have if you've had a look at the report, or to Mei-Ying, to her presentation. So if you place that in the Q&A, we will be able to come back to that at the end of the call. And you also have here again the QR code for those who joined late, with some Mentimeter questions for those that have not yet responded. And now, without further ado, I'd like to turn to our speakers for today to share their thoughts on which we think can give us really important signposts as we move forward on the road to the high-level meeting. So it's my pleasure to introduce you to the first speaker, Dr. Martha Gyansa-Lutterodt, who is the chapter chair of the West African Postgraduate College of Pharmacists. Martha is a health policy analyst specializing in pharmaceutical policy with over 35 years of public service at management level. She holds a doctorate in pharmacist from Kunust, Ghana, and a master in arts in leadership governance and in health management planning and policy. She serves on several national and international boards, and she was the director of technical coordination at the Ministry of Health Ghana before she retired in 2022. So Martha, welcome. And maybe you can tell us from your long experience and engagement at both national and global levels, what is now at stake and what are the opportunities with this high-level meeting?
Thank you very much, Kerstin. I think that these meetings are very strategic enough to guide us as to what should be the asks at the UNGA meeting next year. For me, it is getting late, but never too late. Key things that I believe that could not happen during the 2016 UNGA declaration had been the follow-through. Governments and countries are not able to follow through key recommendations that the IACG made. One would have thought that a lot of commitment will come through, but commitment was a problem, both political commitment as well as technical commitment. When I say technical commitment, I'm referring to professionals that are committed to the cause. I would like to see a lot more actions from our medical doctors, our pharmacists, our veterinarians, our social scientists regarding the key issues on AMR. That is number one. That is a challenge and we have to overcome them. And again, I believe that the issues we are talking about are all interrelated. Think about the Sustainable Development Goals. AMR cuts across almost all of them. If you talk about zero hunger, we are talking about the soils and the animals that may not be available for our use because we have given them too much antibiotics, and therefore we are creating a mess for ourselves. If you talk about leaving no one behind, countries have been left behind in several ways. I believe that countries have made their, what I call the national action plans, but it looks as if it is like a done deal. Once you do the national action plan, it is okay. But I believe that it is not okay. Implementation is key. And the IACG report was very clear that national action plans needed to be supported for implementation to ensure that the goals and aspirations that we have given to ourselves, we look out for them. I must also agree that not just the issues, but COVID has also come in to bring in dimensions. The dimensions that COVID brought is that we are able to gather ourselves and do things together. Of course, that leads us to the SDG goal 17 that talks about multi-stakeholder engagements to ensure that we have value for money for these discussions that we are having. So going into the UNGA 2024, key things must happen. We must get the voices of all the other regions representing key things that they want to see. That is the key ask that we want to see at what our political leaders should give us. We want to see a lot more actions on water and sanitation, how that relates to prevention, especially from my part of the world, where we believe that prevention is always better than cure. How can we set up the strategies for WASH, for instance, making sure that the global goal of water and sanitation is taken to the next level? As we do that, we are in a way preventing the resurgence of resistant strains. And again, I believe that key issues on financing are key. The fact is that that is the elephant in the room. Financing had been a challenge. The IACG recommendations recognize that. And so therefore, every country seems to have developed an action plan, but the action plan moving into action has become a challenge. So I believe that the upcoming 2024 requires countries and regions to come together. For me, what is significant is that African Union now joins the G20. And so that should bring us up to speed as to how Africa can position itself, or low and middle income countries can reposition themselves to speak to the issues, making sure that AMR issues are not lost. AMR issues are linked to our Sustainable Development Goals. There's nothing we can do about that. And countries must also come to that place where when they developed their response to leaving no one behind, the AMR issues are like put at the burner because policy has been developed already. I think that a lot more are required from countries in terms of their governance and coordination, in terms of their action plans themselves, which are prioritized, and not that we bring in so many things that cannot be achieved, but we just put them in. And so I think that coordination, which is a big challenge, need to be dealt with. And I believe that those are the asks we should be making our political leaders make for us. Over, please.
Thank you so much, Martha, for those really insightful comments. And you made a really important reference to how AMR relates to the Sustainable Development Goals. And I think it's really important to show what the opportunities are. And as you mentioned, especially for countries in lower middle income countries, and what the opportunities are to engage. We will come back to you hopefully with some questions later. So I will now move to the next speaker, but before that, just to encourage you again to write any questions that you might have, and also again remind that you see the Mentimeter QR code here for those who haven't done that. So now a really warm welcome to our second speaker, Quentin Batréau. Quentin is the Global Fund Advocates Network's Research and Advocacy Lead, and he was the focal point for the TB high-level meeting that happened this year, in engaging in that work. And he joined GFAN in 2021 after working for Advocacy, a regional health advocacy network based in Bangkok. And he trained as a researcher teaching sociology and political science at the Social Policy and Development Program at the Thammasat University. And he defended his PhD thesis on refugee management in 2020 with Sciences Po. So, Quentin, welcome. You will share some lessons learned from GFAN as you were coordinating the hub, mobilizing civil society in the lead up to the UN high-level meeting on TB, but also engaging, as I understand, in the high-level meeting on the pandemic preparedness and universal health coverage. So welcome. Over to you.
Thanks a lot, Kirsten, and apologies for the long-standing CV. I'm significantly less eminent than the other two speakers, so I apologize for that. But I'm really thankful for ReAct for having reached out to us at GFAN to present today. The reason why they did so, as Kirsten mentioned, was that we are a network of global health advocates. We were launched in 2011. We mostly focus on global fund advocacy. It's in our name, the Global Fund Advocates Network. But we also do broader advocacy on HIV, TB, and malaria, and work on a number of adjacent topics, in particular PPR and UHC. But in particular, we were founded via the Stop TB Partnership in 2018 and 2023 to host the Civil Society Engagement Hub for the successive TB HLMs. And so I'm going to tell you about the work we did. First, what we thought as a network that it was important for civil society to engage. And then I'm going to talk about how we did that, how we engaged, how we made sure to create space for civil society engagement. And finally, some reflections regarding the UHC and PPI HLMs, which I think are relevant in the case of AMR. So why engaging is in those high-level meetings? So Megan actually covered a lot of what I was going to talk about in terms of the global opportunities. It's really a moment to focus attention on a specific topic and to remind government representatives that the attention of the world is pointed at those things, and getting your issue on top of people's agenda, even for a short time, is really important. So let's try at the global level. It's also an opportunity to create a global roadmap with clear objectives. I'll come back to that. It's become harder than it used to be, but still the political declaration is an opportunity to set targets, to keep people accountable to these targets. In particular, in the case of AMR, and that was true in the case of TB as well, there was a chance for a reflection on whether the targets that were set during the first HLM had been achieved, and if not, why that was the case. Finally, it creates a global stage for big announcements. There's not so many of these big global stages. There hasn't been big announcements this year at either of the three big health HLMs, but they could have been. And the odds that the government will want to announce a new program, or new funding during those meetings is higher than outside of those meetings. So one challenge that I referred to is that there's a lot of flaring of international tensions. What that means is that it's become significantly harder in the past few years to get ambitious documents through the UN system, in particular, ambitious political declaration for the HLM system. We really felt that for the TB HLM in comparison with 2018, where we were fairly happy with the political declaration as it came out. Whereas this time around, there was a lot of grandstanding, a lot of block mentality, which meant that certain countries systematically opposed amendments that were proposed by other countries, and that vice versa, which meant that the negotiations were constantly derailed by things that had nothing to do with TB and nothing to do with disagreements on substance. It was really frustrating for us. What I want to bring your attention to is the opportunity of a HLM generally for national advocacy as well as global advocacy. Yes, there are global events, but because you find that ministers of health are being flown to New York twice that year to be in the UN building, meet their peers, speak in front of them on a specific topic, that really brings that topic on top of their attention and on top of the agenda at the national level for at least a few weeks during that year. And that is really an opportunity for civil society to engage and push a specific agenda. Finally, from a civil society perspective, we found that these events are really good moments for movement building. Getting everyone to focus and move towards a singular goal really helps in terms of aligning objectives, getting people talking, getting people interested. So how do you do that? How do you do that movement building, and what did the TB Engagement Hub do? So what was key for us is very, very early on to make sure that we aligned messages across the various civil society groups. The TB space is wide, there's a lot of people, all of these global health spaces are like that. So we tried to bring everyone around the table, make sure that everyone was somewhat aligned, and aligned isn't the same as alike. So we didn't have to all say the same things or say it in the same ways, but rather to make sure we're overall all pushing in the same direction. So we worked over 9 months, so from January to September to October, really, and we produced over that year a stream of products of various kind. We had updates and explainers on the process. It's a fairly technical process, so making sure people knew what had just happened and what was coming up was really important, especially for grassroots engagement. We had regular call for actions, again, to make people feel involved and to remind people that there were deadlines and things had to happen by a certain time. So I was in person in New York, in person in country. We created a toolkit to help people reach out to their representative, their national TB programs, and make demands and push specific talking points, and also a lot of virtual engagement. We also regularly put out analysis of the various drafts and various documents that were produced around the TB HLM. That was really important because the drafts of the political declaration are very technical, extremely technical, and identifying the changes from one version to the next and what these changes mean is extremely time intensive for anyone. And so it was really important to translate this draft into a language that was palatable to most people. And we actually found that the missions relied, we heard from a number of missions, especially of smaller countries, they had relied on our analysis to make their opinion on the different drafts, which was nice to know that work was useful. So to push out all that content, we built a number of channels. We used listservs. Some of them were dedicated, some of them were generalist. We had bi-weekly calls, which were fairly well attended, and we had a constant presence on social media. Because all of those were overlapped, we really felt like we managed to get a lot of people on board and following us throughout those 9 months. What we also worked towards with the Stop TB Partnership, which was funding us, was to ensure that there was a good presence in person of civil society in New York for the multi-stakeholder hearing, which took place at the end of May this year, just before the release of the first draft of a political declaration, and then for the HLM itself. And that was important first because it made sure that there were a lot of civil society representatives in the room that was physically present, and that really helped open doors. But also because there was a chance for them to connect in person with country missions in New York City. civil societies don't get to input in the political declaration directly, so you need to have that access to missions. I see Kirsten giving me the side eye, so I'm going to finish quickly. The last piece of work we did in New York was to engage directly with the Office of President of the UN General Assembly, because they control over the logistics of these big meetings. Very final thoughts on the difference between the TB HLM, UHC, and PPR HLMs. The UHC and PPR HLM were a bit more challenging in terms of engagement because there isn't as long a history of movement building in both cases. Whereas with TB, because there was the first one in 2018, and because more broadly it's a more organized movement, we really found a lot of grassroots support. I think in the case of AMR, there's more closer parallels with the UHC and PPR situation, and so there will need to be probably a lot of focus on that movement building. With this, I'm done.
Thank you so much for sharing your experiences with us. I think there's a lot that can be really useful, both practically and also when you mentioned the political landscape, that was a big challenge, how to navigate that. And I hope we come back to a lot what you were saying also in all the different experiences that you shared. But actually going forward now into hopefully also dive a little bit deeper into those political dynamics, I want to introduce you to our final speaker, Dr. Viviana Muñoz Tellez. So she's the coordinator of Health, Intellectual Property and Biodiversity program at South Center. She leads the team providing policy-oriented research, expert advice and technical assistance activities to developing countries and institutions on health and intellectual property. And she holds a doctorate degree of management technology from the École Polytechnique of Lausanne and a master's degree in development management from the London School of Economics. So Viviana will speak to us about the political landscape and some other comments and insights from also your experience with some of the high-level meetings. Welcome, Viviana. Over to you.
Thank you, Kirsten. Thanks overall to ReAct. And just to say, I think this is great work you're doing and in holding these webinars. So I've listened and learned a lot from the two previous speakers. The first point I'd like to make is that when we're looking overall at, what can we do in the scope of the United Nations General Assembly, that is, of course, framed in a way much more narrowly than everything that is going on globally in the space of different agencies at regional level, domestic level. So just to bear that into account, that we really have to find the right place for what should be the role that a high-level meeting has. So what can it achieve? Of course, we want that to be ambitious, but it also has to speak to the other related processes that are taking place. And of course, as has been mentioned, a number of factors that might influence what might be, delegations that are based in New York that deal with a number of issues. They're the ones who will be negotiating this. So first of all, I'd just like to go back to the context of the high-level meeting of 2016. So that was the first high-level meeting on antimicrobial resistance. So we've had one experience only. So if you compare to HIV/AIDS, tuberculosis, universal health coverage, there's been a number of high-level meetings. And they've been building on each other. So with AMR, this will be only the second. That is to say, we've had a couple of years since that first multilateral UN level discussion about commitments, building upon the Global Action Plan on AMR in 2015. So what did we learn from the high-level meeting on 2016? Well, first, I think is that for 2024, what we can learn is that we should be building on the text we had in 2016. That's really important because I've speaking with different parties, sometimes there's not even a mention to the 2016 high-level meeting. And that is the text that negotiators will usually revert back to naturally as the basis for this negotiation. So it's useful for all stakeholders to just be informed of that 2016 text. It has really important elements, including from the equity perspective, that meaning to understand that not all countries have the same capacities to take the different interrelated interventions on antimicrobial resistance, that also this has to be led domestically. So we need to empower stakeholders at country level and government officials and make sure that there can be a One Health approach, but that really understands the local context and the kind of challenges that people are facing. I really like, for example, that the World Health Organization has come up with a people-centered approach to AMR as part of now a new guidance for the work on the human health side. because that informs understanding of why people are doing certain behaviors that, helps drive antimicrobial resistance on the human side. But we could say the same thing for the animal health side. Why are we seeing, such increased use of antibiotics and other antimicrobials? And how can we then deal with those problems? That's a really useful new tool that we have since 2015. So then in terms of the 2016, I think we don't have to reinvent the wheel of a lot of what's already there, but we need to build up on those elements towards more concrete commitments. So for example, it's clear that if we look at just comparing that high-level meeting to others like TB and HIV, these other disease-focused areas have been able to establish global targets. Now, in AMR, that's much more complex in the first sense because we don't have the same situation of a particular disease we're targeting. So we have to find a better way to communicate what is it that we are trying to solve. And I think that is not something that is obvious. It might be obvious to the AMR community, but when you're going to have a text that is looking for high-level political commitment, you really need to put that, in a much more easy way to communicate what is it that we're trying to solve. I think that is an important element compared to what we've seen in the previous AMR tools, is that perhaps the public was not really understanding, and even the high-level policymakers were not really understanding what is some of these technical interventions that we're trying to introduce to a very high-level UN kind of negotiation. So I would start by suggesting we really need to also get clear, if we can't have a global target per se, although that idea is something to guide us, the idea of how it's been useful in HIV, in TB, but we can't readily say, well, we want to eliminate disease X in 2030 as we have in other areas. Here, we have to be clear of the objectives being, we need to be able to continue to treat infections with effective antimicrobials that we have now and new ones that might be coming. We need to reduce the levels and slower the development of resistance. And overall, we want to reduce mortality and morbidity due to AMR. Now, those concrete objectives, we can develop some sort of targets about what we would like to see as the outcome of our interventions in AMR as a general framing. Now, the other issue is now how do we take into account that there is a lot of guidance from the quite parted agencies, so FAO, WHO, WOA, and UNEP. And we don't necessarily see in the 2016 high-level meeting that was fully reflected. And the issue is we're trying to add value to what's already being done. We don't want to say to the UN General Assembly, give us guidance that's any different or additional to what is already existing guidance. But we need is to put this together on a more holistic framework and really bring in its political will. So I think overall objective of the high-level meeting, as in others, has to be really getting everyone on board. So the consensus approach, not so much getting stuck on the nitty-gritty technical details. Do we have everything covered in this high-level meeting? Because that won't work in this negotiation context. I think, as you've heard the previous speaker say, we are in a difficult or more complex political environment that has shown, for example, in this year's high-level meetings, they were not just the high-level meetings taking place. There was a number of other meetings that happened during the United Nations General Assembly week. So high-level meeting on AMR already is not necessarily, a big radar for many delegations, particularly ones that have very few people, so that can't give such a focus to this issue. So in order to compete adequately with so many other issues in the agenda, I think we have to make that simplified, and we have to really push is on the severity of the problem, but really also trying to communicate in a way of what is it that we can actually do, not just sell, we have, the close to 5 million deaths that are reported for antimicrobial resistance. That's clearly, an important factor to bring forth, but we also want to say is that, we really want to put together what we have already as guidance of different agencies and put that concretely into one single document. Now, in terms of mobilization, in terms of what's happening overall in the current context, I think we can also be informed by the discussions that have been taking place on a pandemic instrument at the WHO. So there was a discussion to also bring this to the UN level, but so far it's been only within the scope of WHO. The reason for broadening would be because we want to take also a One Health approach generally to preventing pandemics. And we know that having effective antimicrobials is really essential both in prevention, but also in situations of pandemics when we need to make adequate use and also continue to safeguard through stewardship the use of antibiotics. We saw that, there was a significant misuse during the pandemic simply because people needed treatment and we weren't sure what tools people had available or anyway for diagnosing what was the situation. So I think what we can learn, though, from the process of trying to integrate AMR in the pandemic instrument at the moment is there will be a need to balance the different concerns of countries within the text. So it is a political negotiation. And so that's why equity, that's one of the points I want to highlight. Equity concerns are really central, which means also balancing the different interests of what country delegations will want to see. And that brings me to perhaps one of my last 2 points, which is about process. We want to ensure that we have a process that is seen by everyone that is quite fair and balanced, so open to all inputs from all countries. If we see a process that on the one hand, is already directly coming either from the Quadripartite organizations directly, more feeding into the process. So we would say, for example, when we look at the high-level meeting on pandemic preparedness and response, there was a lot of input prior from WHO, but they also did consultations between New York and Geneva to help ensure that there would be inputs as well from the two related processes. On the other hand, civil society felt that they were not necessarily fully part of that process in preparation. And I think those are lessons to be learned for this process since it's starting and we haven't defined fully the modalities that we ensure that we have both governments feeling that they're fully on board so that it's not just led by a few countries and what will be the text, and that also means a broad participation of different stakeholders, including civil society from developing countries that can be part of this. So for example, even if participation in person might not be available for everyone to consult in New York, to make sure that does happen in a virtual way. And then again, if there can be more consultations to be able to ensure that we can have some agreement on the broad areas of the high-level meeting and not to have, a very detailed and difficult negotiation coming to September, which is competing with a lot of other agendas. Now, my last point would just be in terms of priorities for the high-level meeting. I think Martha, with all her wonderful experience and way of expressing, has clearly said that one of them clearly is prevention. And from a developing country perspective, that is really key. We know that the SDG, which relates to improving access to water, hygiene, and overall infection control. Now, this is way below what is the SDG target. So we need more investment there, and that would support AMR. So bringing this in within AMR is really important to highlight that point, as she was mentioning. Also to ensure that this is from a One Health approach. So if you see, we had two very specific now indicators for AMR within the Health SDG, but they're so technical that it's very difficult to explain, particularly to high-level policymakers, how that is the particular aspect of AMR we want to see integrated SDG. So we can broaden our discussion of how to view AMR within the SDG context. So prevention is key. The other issue is improving infrastructure and human resources, both for preparedness, for surveillance, as well as for response, access to medicines and diagnostics, for example. The issue of stewardship being a key issue as well. In all countries, that should be also from the animal and human health side. And then global support, both financial as well as for the Quadripartite institutions. They're the main technical assistance providers to developing countries, and their work is really essential as well. And I think that in the 2016, that was not necessarily fully reflected, that they need more support as well for their activities. And as you see with other areas, they have global plans with costed global plans. Here we don't have that yet for AMR. So having a better sense of what are the kind of resources that need to be mobilized will be an important input that I think the Quadripartite is working towards putting forward. And then finally, since national action plans is the basis for showing actions on AMR, then as Martha said, coordination between different institutions is a key element. At the same time, the costing of what resources are needed. And then a big gap right now is in terms of reporting. So there's no real monitoring and evaluation frameworks between national action plans. So we can't really, as a community, look at and actually evaluate the implementation of national action plans. And similarly, there is a monitoring evaluation plan for the Global Action Plan of 2015. So those elements could be introduced to the UN high-level meeting without being anything that's new, but it's already being developed. So national action plans right now are reporting on a self-assessment basis only through the track system. And we really should be working towards having something where we can see the data, be more transparent about it, and that way build more accountability. So I think that for me would be some of the key asks for this high-level meeting. Thanks, Kirsten.
Thank you, Viviana. Yeah, there's certainly a lot of things to say about priorities, but you mentioned also really importantly the importance of a common understanding that we actually, rather than going into much detail, as you mentioned, it's important that everyone actually agrees on some of the bigger goals as well and the common understanding. I think that's worth repeating. And also the challenges with target setting and somehow also how AMR differs from other issues. So thank you so much, and thank you to all the speakers for your contributions. And I also would like to, before we go and open up to some of the questions that have come in, wanted to turn to what you have also put in the Mentimeter. And so we'll take some time just to look at those responses. So I will hand over to my colleague, Eva Garmendia, project coordinator at the Uppsala Antibiotic Center, to walk you through what you have been saying. And also she has maybe an additional question for you. Over to you, Eva.
Hi, yes. Hello, everybody. Thank you so much, Justin, for giving me the voice now to bring up what you guys have been sharing with us in this webinar today. So first, we had on this Menti a question to you that was, what are the key actions that would move the needle to get ambitious and concrete outcomes of the high-level meeting? And I think a lot of the questions that a lot of the answers that you have posed here in your answers reflect a lot of what our speakers have talked about today. So Martha was mentioning the importance of WASH into the upcoming high-level meeting, and that was also highlighted by you. But as you can see, there are other things, other answers that are focusing on the need for the country or regional mobilization, and have those key stakeholders in the discussions early enough. Also about the processes, so early engagement with the co-facilitators at the New York country missions of the United Nations, ensure that those civil society voices have the channels through which to influence the political declaration, as we were hearing just recently as well from our speakers. We need community solidarity to develop call to action and develop the asks and also advocacy toolkits. Obviously, we cannot disregard the need for financing. So some commitments in terms of financing seem to also be important for some of you out there. And we also need to have this bottom-up approach, so grassroots advocacy being integrated into what's coming up on the high-level meeting next year as well. We also have now an extra question for you that we are thinking that if you can now log in again on the Mentimeter, the link is on the chat, but you can also join at menti.com and use the code 22162094. And we are very curious to know, in your view, what would be a successful outcome of the high-level meeting? So if you think inwards and you are thinking on this perhaps utopical or like very blue sky future, what would you like to see coming out of this high-level meeting? And we are going to leave this question now here for a couple of minutes, 1 minute. You can also join in after during the Q&A and the panelists answering your questions that were posed on the Q&A in the meeting, because we actually are very interested to get your ideas, and because the answers to this Menti are also going to be part of the public record of this webinar, we really want to gather your insights and your thoughts out here. A strong civil society movement on AMR, that's been also mentioned several times throughout the webinar today. All countries committing to set national concrete targets, that would be really ideal for sure. And I think on the on the interest of time, I will leave this question ready for you to answer as long as you can join into the Menti through the link or through the QR code and code in the Menti that you see in the screen. And I'm gonna give the space back to Kerstin so we can address some of the questions that you've been posing live in our Q&A during this meeting today. Thank you.
Thank you. I see some answers are coming in, but as Eva mentioned, we'll be able to share them also after the meeting. And so I wanted to invite our speakers back, and if you could turn your videos back on. We have one question coming from Sibia Esak. Welcome, Sibia. And a really important question about what happens actually after the declaration, if hopefully there is one, and after the high-level meeting, and how do we actually hold countries accountable to deliver on targets once targets are set? And is there a soft mechanism that can be created with tables on progress to create competitiveness amongst countries? And would we consider sanctions even as a hard way to force countries towards progress? So I'm going to maybe start turning to Martha. If you have any thoughts on this, what are ways to hold countries accountable?
Okay, I think that the suggestion from Professor is a good one. I believe that the SDGs are already targets set for countries, and we all have rules and defined areas that we needed to go to. But for the AMR, I think that there are no realistic targets for countries, and therefore, if you have what we call like a league table, just like how we all love football, you have the league table of who is performing well with set targets, like take, for instance, which countries are doing well with WASH, which countries are doing well with coordination, which countries are doing well with domestic fund mobilization, which countries are working within the One Health space. I think that with that, countries will be encouraged, or countries will be put in a spot whereby they are willing to become the best, sort of. And I believe that that is also one way of getting it done. The other one will be like, I saw another question around the WASH, which I will put in together, that we need to look for low-hanging fruits. Going to the UNGA, we need to look for low-hanging fruits that we can all agree that this is something we need to do. During COVID, we all agreed that we needed to wash our hands. We all agreed that we needed to do the personal hygienes. We know that if we do a lot more of WASH, which is a low-hanging fruit, build the necessary architecture to ensure that countries buy into it. I believe that when we come back in 2 years to find out which countries have done this, it will be obvious to all. And so I believe it is important to look at the narratives that we are getting across board. The narratives, are they speaking to things that are doable? We are not just sending a shopping list. We are looking at prioritized action plans that are bringing out things that we can do within a certain time frame. So I think that it's important we keep an eye on the ball and ensure that that way of targeting countries and making sure that countries stick to what they said they would do is the way to go. I believe that the HIPB also provides us an example. The 90-90-90 is for all countries, and you know what you must do to ensure that you meet those targets. So those targets and peer review mechanisms are strategic if we want to go forward. Over.
Thank you so much, Martha. Really important comments. And I think maybe handing over to you, Quentin, from your perspective and maybe from the experience of TB and maybe even HIV, do you agree with what Martha was saying? And how has it been possible to hold countries to account with the previous declarations as you see it?
Yeah, it's a bit of a tricky question. I think the situation is quite different for HIV and for the other HLMs, but through experience. I don't want to repeat what Martha said. I completely agree with the key. The key is really country level advocacy, keeping track of what people are doing, and keeping their words. How much that works, I think, is open to discussions. I think one side of the conversation that is worth bringing up is the connecting this objective to specific funding mechanism. So we saw the Global Fund putting out during COVID-19 the COVID-19 response mechanism, for example, which is now being retooled towards PPR and system strengthening. The pandemic fund is putting out some money that could be targeted toward AMR as well, and so I would say that's another way to keep country to push countries to actually take action on their commitment, is pointing them towards funding streams that they can tap to actually implement their plans. Yeah, but I want to say that I think the experience of TB has been that the 2018 targets were like missed across the board, and so it's not very encouraging in that regard. But at the same time, at least it gets us we can at least say that, like, it's clearly better than if we didn't have those targets and things were just horrible, but also we couldn't point people towards an alternative where things are less horrible. So it's not very hopeful, but it is good to have targets even if there's not clear implementation mechanism.
Thank you, Quentin. So the importance of aspirational targets, indeed. So if I turn then to Viviana, your thoughts on this question about accountability, what would you say could be some of the ways forward?
Yeah, so first, I think, what we need the most is really to build consensus, as I was saying. I think, for example, hard measures, they might have, in practice, actually be counterproductive. So if we look at what's happening right now with the reporting to the GLAS system, right?
Yeah.
This is the country's voluntary self-assessment and how they're doing. Right now it's voluntary, and if you speak with implementers, they'll tell you, because this is the way we're getting information from countries. If we make this at this point mandatory, perhaps some countries will not even provide anymore the information they're doing. Now, at South Center, we support the idea of having much more concrete accountability mechanisms and actually more transparency in the reporting, because right now that information we can't verify, right? So as was mentioned, we need both more concrete domestic advocacy. That's really critical to be able to actually track and say, hey, this you're not following through, this you're actually doing well, especially from academia, being able to track and see what have been the results of intervention. So really supporting government as well, working together. But when we look at what globally we do, I think the cooperation element is the key one, more than saying, well, right now we're going to think of sanctions or this kind of issue, where I think reporting mechanisms is what has worked so far. So making as much facilitating developing countries reporting, because if you make them too difficult, as we have in many international instruments, then countries are spending more time in reporting and are ready to donors, for example, that are providing financing on a grant by grant basis versus just having more open funds. So we don't want too much reporting, but we want it to be concrete enough where we get the minimum data that should also become more comparable, because that's another problem in AMR. We are not able to set part of the targets that we want, since we don't know even, the methods are not being used the same way to make also the data that's available in a comparable basis. So there's a long way to go. But I think we should focus on how can we get everyone together to cooperate on this issue? That is the basis. And second, learn from what are good examples. So there's a lot of good work that is happening in countries. How do we build on that? How have we had that? So I think, again, that local advocacy has been critical, and in AMR, we need to build a lot more to see the great work that the HIV community has done from the ground level and on TB and others. How can we build that even more in AMR? So we need also that financial support also for the community level, and it's not forget also veterinary sector and everyone who's on the animal side, that's also very under-resourced, and they really are working with their nails in many developing countries. So I think that is important. And then at the global level, it's more about how can we talk about what are some of the problems that lead to not being able to take more active interventions in certain areas. For example, with surveillance, how can we improve the systems? How can we improve donor coordination? How can we improve financing? That's a key issue. If we see what's been achieved with HIV, with TB and other areas, financing has been a huge part of what's the global support mechanism. And then countries to then really, build their own national action plans to know their way forwards in the local context. But the accountability is from bottom up, I think, that will have more impact.
Just to throw in one aspect, that is the role of the civil society, as somebody raised it. And I think that at the country level, we don't see a lot of the push from the civil society groups, especially in my part of the world. And we need to make sure that they can put governments on their toes, because when they keep, I know what the civil society does with NCDs in my country. And I believe that if we are able to garner the advocacy at the country level, it can go a long way to support the drive towards making sure that the grassroots advocacy takes root properly. The role of civil society is very key and strategic.
Thank you so much, Martha, and thank you all. I think there's so much to take away from what you've all been saying, and it's really important. Thank you for Siviet for raising the question about accountability, and I think I'm looking forward to see what people have also entered in the Mentimeter about how to really get that success from this meeting and galvanize support, including on financing, as several of you have mentioned several times. And so we're going to unfortunately have to start wrapping up this call. It's been really, really good. And thank you so much to the speakers for today. We hope we can continue this discussion also with others on the call. And before we close the call, I would like to hand over the word to ReAct Europe's director, Anna Sjöblom, who will say a few words about ReAct and what we're planning in the way forward. So Anna, over to you.
Thank you so much. Can you hear me now?
Yes.
Yes, great. Thank you so much. First of all, thanks to the speakers. I think this was a very good short format also, and you shared with us the many different perspectives and political realities and aspects and different voices that needs to be heard ahead of these high-level meeting next year. And we in the ReAct network, we have been focusing on this for quite some time. We started already before this Uppsala dialogue meeting that you heard report back on to, and we at the moment we are gathering with together with ReAct Africa, ReAct Asia Pacific, ReAct Latin America, and ReAct Europe to jointly develop our positioning and focus areas for the high-level meeting. And just a couple of highlights on what we would like to focus on. And several of those have been mentioned this afternoon. And first of all, we'd like to increase awareness on ABR and engage different stakeholders, including civil society, community groups, toward political impact in the countries and regions where we work. And we are then planning here to follow up this webinar from our end and with other meetings with communities and civil society to be organized here and also on the other continents where we are present. Another thing that have been mentioned is to engage key governments and to do it in a different way and to more of them than before the meeting in 2016. We believe also that, to enable a future collective response to this, low and middle income countries are critical in this process. So we here planned a round table discussion during the spring with several representatives from countries, including LMICs. We have also, ReAct Africa has been officially appointed as to chair a task force in Africa CDC, African Union, that is leading the work ahead of the high-level meeting for that region. And in ReAct Latin America, we also mobilize and we'll use platforms like People's Health Movement Assembly in Argentina in April next year to leverage and to prepare for high-level meeting. And also inspired by different dialogues, including Uppsala and ReAct Africa, a conference in August, we will have soon develop a briefing paper that can be shared with where we focus on our key messages and what we see as key actions to success. And we're quite aware of that the clock is ticking, not only for this webinar that we need to close now, but we have 10 months ahead of us, and we're up for a difficult task to get more actors, more people around the table, and more voices to be heard. And time is also ticking for like action in general, to get the systems change that needs to come in place in time to be able to protect this life-saving resource that is the antibiotics, and for us to come closer and not further away from fulfilling our mission of sustainable, equitable access to antibiotics for all. So with that, I would like to thank everyone who's been following the seminar, this webinar, and we hope to see you soon and to be able to stay in touch. And thank you to the ReAct team and to all of you who followed, and to the speakers. Thank you so much.